Hello, I'm Bill Adams. I'm 65 years old, and in October of 2015, I had a total hip replacement at Dickson-Diveley Orthopaedics. Prior to having the hip replacement, I had probably 6 to 8 months worth of pain by doing something as simple as walking. I enjoy mowing my own lawn, and I couldn't even do that all the way through without stopping 3 or 4 times just to rest to alleviate the pain. Before going to Dickson-Diveley, I saw another doctor and was taking anti-inflammatory drugs on a regular basis, and also had a series of anti-inflammatory injections in my hip and also in my back. And while those provided a small amount of relief, it never lasted. So that's what led me to go to Dickson-Diveley.
Bill first presented to me complaining of hip pain. His pain was both in the groin and around the side of his hip. I determined that his pain was due to advanced osteoarthritis. When I first met him in clinic, he had already undergone attempts at conservative treatment with injections in his hip, as well as anti-inflammatories and changes in his activities. Unfortunately, none of these were providing him with the relief that he hoped for, and we determined that the best course of action for him would be hip replacement.
After my hip replacement, I stayed home from work for about a week, after which I went back to work. I worked primarily at a desk, so it wasn't real difficult, but I was able to get in and out of my car and drive and do all of those things and get around just fine. I had physical therapy for about 2 months, and I was able to get out and walk around. I was able to cut my grass again without a problem, and it just continued to get stronger as the months went on.
Every patient's recovery from hip replacement is different. Some patients have motivation to return to work or activities extremely quickly, while others take a little bit longer. We allow patients to increase their activities as tolerated and do expect a quick recovery, but the time frame will vary.
Today, here we are 2+ years later, I feel great. I can walk around just fine. I could run if I wanted to. I think my hip's pretty much bulletproof right now.